Hello folks, we have with us Dr. Tarun, a leading orthopedic surgeon at Santosh Hospital, Colts Park, Bengaluru. Welcome, doctor.
Hello, Ranjita.
In the present scenario, doctor, we find at least one person in every family suffering from arthritis, primarily the arthritis of the knee. And also, according to a recent survey, nearly 180 million people in India are suffering from arthritis.
True.
So, with respect to this, I would like to ask you a few questions about arthritis of the knee.
Sure.
So, doctor, what is knee arthritis?
See, knee arthritis is like the wear and tear of your knee joint. Actually, first you have to understand what is a knee joint. Knee joint lies between your thigh bone, leg bone, and your kneecap. And the normal functioning activity happens because of the gliding of the two surfaces of the knee, which is known as articular cartilage. With the wear and tear of the cartilage, as the age grows, the lining becomes rough and they start rubbing against each other, thigh bone and the leg bone. That's known as a knee arthritis, which may make the condition crippling for a patient. He may have difficulty in walking, squatting, climbing up or down the stairs.
So, what are the main causes of knee arthritis?
See, main cause of knee arthritis is lack of activities, lack of exercise, being overweight, obese, and kind of activities like usually the Indians involved in themselves, like squatting, sitting cross-legged, sitting over the ground, using low-sitting chairs and Indian-style commode. Other causes may be like rheumatoid arthritis or arthritis due to an infection.
So, can you please tell us about the symptoms of knee arthritis?
Symptoms of knee arthritis ranges from pain and swelling around the knee, difficulty in walking, every step becomes painful, difficult activities of daily living like climbing up or down the stairs, sitting on a low sitting chair, squatting or sitting cross-legged over the floor.
How is the arthritis treated?
Arthritis can be treated with medicines, with exercises, and finally, when it's advanced to a later stage, surgery is the option. Now, when you talk about the medicines are painkillers, which depending upon how is the condition of the patient, whether the patient is a diabetic, and how is his kidney functions. Then coming to the lifestyle modification is the dietary modifications, going on a leaner diets, then involvement of oneself into the exercises, losing weight, doing exercises for the knee joint, few physiotherapy for a few days. When we talk about surgery is involved in the cases which have advanced level of arthritis.
Doctor, how as an orthopedist do you decide on the necessity for knee replacement surgery for a patient?
Knee replacement depends upon the stage of the arthritis that the patient is suffering from. Usually late stages 3 or stage 4 requires surgery. In these stages, patient's life becomes crippling, patient is unable to walk, walking tolerance or a walking distance become 0, patient is unable to squat, sit cross-legged or do activities of daily living.
Doctor, so how long does it take to recover from a knee replacement surgery?
See, immediately after the knee replacement, patient can be mobilized same day evening or next day morning. Initial 2 weeks, patient has to use a walking frame to walk. But there is no restrictions, they can use the toilet themselves and walk around within the room or go even outside the room. Our 3rd week onwards, patient requires to use one walking stick, that's a tripod walking stick. At the end of the month, they can discard even the stick. But at the end of the month, patient may be walking around half a kilometer to 1 kilometer. Then the improvement of distance happens month after another. So you can take it overall around 6 to 8 weeks for a patient to completely recover after the surgery.
So, will a person be able to walk like before after the knee replacement surgery?
After the knee replacement surgery, person is able to walk as normal as before developing the arthritis. It will take few weeks for that to be achieved.
So, what are all the precautions to be taken post the surgery?
See, post surgery, usually patient is advised not to squat or sit cross-legged, avoid low sitting chair or an Indian commode. Apart from that, patient has to take care of the wound, like avoiding contact of water with the wound and taking care of the wound till the time sutures are removed.
Thank you for joining us, doctor.
Welcome, Ranjita.
Thank you, folks. We will be back soon with another important health episode. And yes, if you have any questions on knee arthritis, please mention them in the comment section below. Dr. Tarun will answer your questions. Thank you.